Here at World Horse Welfare's Glenda Spooner Farm, all the ponies have their own individual healthcare plan. But how do we build one, and why is it so important? In this episode, we are going to be learning how to bring one together from a group of allied professionals. I'm going to be speaking to a vet, a farrier, a physio, a nutritionist and a saddler, and by the end of our conversation we are going to know exactly why it's so important to have a healthcare plan in place for our horses and ponies. Let's get started. So Stuart, would you mind explaining to me your role here at Glenda Spooner Farm?
So we're an independent vet practice, but we do the vet work for World Horse Welfare at Glenda Spooner, and that involves a vet visit once a week, where we come in and do routine work or anything that's come up during the week, and then obviously we provide emergency and more urgent care that's as and when the staff here find a problem and highlight it.
Brilliant. Well, today we're learning all about how to build a horse's annual healthcare plan. From a veterinary point of view, where should I start? Where should a horse owner start in building their annual healthcare plan?
Well, the simplest place to start is probably to get some of those annual or really infrequent things down. So vaccination is something that lots of people will be familiar with. With most horses that would include tetanus, which is every 2 years. And most horses should be covered for influenza as well, which is an annual vaccination.
Okie dokie. And how do I start if I just bought a new pony? How do I start them on a course of these vaccinations?
So often, if you're buying them new and they're already adult, hopefully they've already started their vaccinations, and so it's worth having a look in the passport. And if you need to. Most vets will very happily just look through that with you the first time they come to see you and check your horse over. But the first part of the vaccination course is a 2-part course. Okay. And that gets those are usually 4 to 6 weeks apart. And that gets your horse protected. Unfortunately, those vaccines then don't last for a whole year. And so there's an early booster, which is usually about sort of 5-6 months later. Okay. And then you're onto the annual cycle. Mm-hmm.
And then I have to remember to then get that annual jab every year.
It's worth writing it down somewhere. So a lot of vet practices will have a reminder system, which will prompt you. But like everything, those are usually a computer program that throws it out. So it's possible for them to go awry and occasionally miss it. So one of the reasons that actually having a annual health plan written down somewhere, or there are lots of apps that will do it for you and just prompt you, is really useful, because these things are so infrequent that it's so easy. We've all got busy lives. It's so easy to forget them.
Absolutely. Quite right. And do I need to get my horse vaccinated? Is it compulsory, or is it just if I'm competing? Is it something that you would recommend for all horses?
So it's definitely something we would recommend for all horses. In my opinion, tetanus vaccination is an absolute must for every horse, no matter what you're doing. The difficulty with tetanus is that it's unpredictable. It's in the soil. It could be absolutely everywhere, and it's in an unvaccinated horse. It's almost always fatal if they do pick tetanus up. Okay. Flu is one of those diseases that most horses should probably be vaccinated for, unless you're really out of the way. It is endemic in the UK, and it's a disease that, again, in unvaccinated horses can be quite serious. And both of those are covered in the normal annual vaccination. Okay. Flu is mandatory if you're competing. Yeah. And that's something that will be really important. And it's worth, the different competition authorities have slightly different rules on how they feel about flu vaccinations and what frequency they should be done. So it's always worth checking with
keeping an eye on
competition authority.
And is there anything else I should be vaccinating my horse for? Is it just those two that are the prime?
So herpes virus is becoming more and more, I think owners are becoming more and more aware of it. Again, it's a very, very common virus. Okay. And in a lot of cases has a relatively mild disease associated with it. Often it's the sort of can be the horse equivalent of a common cold, but there is a really nasty consequence that's thankfully quite rare, which can be a fatal paralysis. And we know now, previously we've thought that that may be a different strain of the virus, but we know from the outbreak they had in Spain a couple of years ago that it is just a very, very large dose of herpes virus 1. And so it's the vaccinations that can be done are protective. So it's worth thinking about herpes virus vaccines.
Sounds like it, absolutely.
Yeah, particularly if you're competing, if you're going out, but even if you're just mixing with a lot of horses, if you're going out regularly and doing fun rides,
or a pony club, or it might not necessarily be competition, but yeah, worth considering.
That sort of big group is where you're likely to pick this up.
Okay, I see. So vaccinations, tick. Moving on, how about deworming? I feel like that could be another important factor in the healthcare plan. Where do I start with that then?
So absolutely. So parasite control, really, really important. Horses have both, you get both roundworm and tapeworm. Of those, roundworm is the one that we regularly worm for.
Okay. And
when I started in practice, people would have been worming their horses every 6 weeks or every 3 months, depending on the wormer, on a regular basis. These days, there's so much anti-parasite resistance coming into the worm population that if we can avoid using wormers, that's the best way around. And so testing your horses, fecal worm egg count, particularly during the summer, is really important. We recommend that that most horses are tested every 3 months.
Okay.
The advantage of that is usually it's cheaper than giving them a wormer. There's certainly quite a lot of horses that don't enjoy being given a wormer. It's not a particularly invasive or painful thing to do, but they don't like it.
I can understand why.
And if we don't have to treat them, if we don't have to use a drug because they're not carrying sufficient levels of parasites to need it, that's obviously better for the environment, better for the horse.
And you're not adding then to the resistance either if
Absolutely.
You're overusing a drug that you don't really need to be using. So doing a fecal egg count is really important.
Really, really important. And tapeworms, it's probably sensible to, again, if you're at a low risk situation, it's sensible to test once a year. That's slightly more complex in that they're not picked up on a fecal worm egg count. But there is a nice new saliva test, which it's a little bit faffy to do, but if you follow the instructions, it's pretty straightforward.
Is that when you've got to put the swab in their cheek?
Yes.
Yeah.
Yeah. And roll it around until the little thing turns pink.
Yes, I've seen
and
one
then
before.
you send that away to a lab, and they'll give you the levels. Tapeworms can be really important in things like colic.
Okay.
So it's worth checking for them, but again, we probably don't need to be treating all the time
for them if they're not there.
The concern is we don't have any new wormers on the horizon.
Oh, really?
So any resistance problems we get, if we get widespread resistance to some of these wormers, we're going to be in trouble.
For sure, absolutely. So what time of year should I be doing my saliva test for the tapeworms?
If you have reason to suspect that your horse has got tapeworm, then you can do it any time of year. But traditionally, we've always tapewormed horses in the autumn time, particularly when it gets cold.
Okay.
The reason for that is that some of the species of tapeworm have an intermediate host, which is a harvest mite. And so if you give your horse a tapewormer in the summer, those harvest mites are still around, so there's still a reasonable chance they may pick them back up again. So doing it after we've had a bit of cold weather kills off the harvest mites, and then you know that any tapeworms that are in the horse are killed off.
Fantastic. Okay, so we've covered vaccinations and we've covered deworming. The next thing I think could be on the list is maybe their teeth, getting the dentist out. How often should we be getting our horses' teeth checked?
So that depends a little bit on the age of the horse, what you're doing. Annually is recommended really as a minimal. We at my practice were absolutely passionate about dentistry. Dentistry is one of my particular areas of interest, and so it's something that we do very, very regularly. And there is a difference really in a lot of horse owners will be familiar with the idea of a tooth rasp.
Yeah.
But actually things have moved on slightly, and so a dental exam is probably equally as important, if not more important, to try and pick up that early pathology, very similar to us, and with younger horses or older ones, or those that are in a reasonable amount of ridden work, it's probably sensible to think about an oral exam every 6 months.
Every 6 months, yeah.
Even if they don't need treatment.
Well, prevention's better than cure, isn't
absolutely.
it? So.
If you think about us, if you go into the dentist and you have a 6-month checkup and the dentist says, that's great, you don't need anything doing, you think that's brilliant, and you walk away. And so there's no reason really why we shouldn't be looking at our horses every 6 months, and said potentially not needing to do anything, but just making sure
just
we're
to
not.
double check, especially if you're experiencing some behavioural issues with your animal. You can then cross that off, the list of things to look for, maybe if they've got mouth discomfort in some way.
And we tend to, at the practice, we tend to do most of our dental work, most of our dental exams under a light sedation.
Okay.
It's very, very safe, but it takes the stress out of the situation. It lets us get in with a dental mirror or even a dental camera and just have a really close, detailed look at everything, so you're not missing anything.
So that is something you should expect from your dentist appointment for your horses, that they might be sedated in order to have a proper
absolutely
look.
Certainly if they've been done by a vet. There is, unfortunately, in the UK, there's no rule as to who can call themselves an equine dentist.
Oh, really?
So there is a variation in once you get away from equine vets doing it, there's a variation in the quality potentially, or certainly in the training and consistency. So if you are having an equine dentist do it, we normally recommend that it's somebody from the British Association of Equine Dental Technicians, so the BADT, or your equine vet, as long as they've got an interest in teeth. Or
they should be able to recommend someone.
Absolutely. If it's not something that they do, it's something they should be pointing you in they'll be able to point you in the direction of somebody of good quality.
I see. And here at Glenda Spooner Farm, they take the approach of the whole horse approach. They talk about, and it's looking at all aspects of treating a horse, using all our allied professionals to come together. Is this something that benefits you in your role as a vet, working with other professionals to treat the horses here? Hugely.
It's got to be a team approach. There are a very good example, something that happens almost routinely with vets, is communication between a vet and a farrier. A good example is Ian, the farrier at the centre. Often I will be looking at a horse that's maybe got a lameness problem, showing signs that it's the foot, and we'll pick up some problems on X-ray or exam in the foot, and I'll go to Ian and say, here's the problem that I want to overcome. Here's the balance. This is where I want to take pressure off, and Ian will come back and say, I've got a brilliant solution for that. We can do this. There's a new thing on the market. We can use these shoes, or I can simply balance the foot. And that communication is essential, and it doesn't matter whether we're talking about the farrier, the physio, the vet, the behaviourist. All of these disciplines interplay to get us the best possible outcome. Yeah, to move forward with the whole horse approach. Brilliant. Thank you. So Ian, we're here at World Horse Welfare's Glenda Spooner Farm in the glorious sunshine. Would you mind explaining to me a bit about the role that you do here?
I'm the farrier at Glenda Spooner. I've been coming in 14 years now. Such a fantastic job, such a variety of work to do, and no 2 days in the weeks are the same when you come in. You just literally see what's on the list and take it from there. Some of them are straightforward, some of them are not so straightforward, temperament wise, and understandably. That's the nature of the centre, is to try and help and rehab as many horses as we can and give them the best start to go out to hopefully lovely homes.
Absolutely, and each of the individual horses and ponies at the centre have their own unique health plan, and today we're discussing how we can build a health plan for our own horses and ponies. How important is the farrier work? How should that be included in this health plan?
Oh, it's paramount. It's the same old adage, isn't it? No foot, no horse, and it's the building block. So 9 times out of 10, lamenesses start at the feet.
Is that right?
you'll get a vet come out, and more often than not it's the foot. So we have to be aware of that, and it's maintenance, it's keeping the horse at its best optimal performance for whatever role it's going to do, whether it's going to be a field companion, whether it's going to be a hack, whether it's going to be a competition horse. They've all got to have a sound footing, and if they haven't got a sound footing, they're not going to do what they're being asked to do.
Oh, absolutely. So how often would you be seeing the horses here, or how often should horse owners be getting their horses' feet looked at?
Well, I obviously see them on a regular basis here. I'm in here once a week, more if required, and each horse has its own plan. It depends on what's going on with the feet as to how often we would see them, but in general, work horses between 4 and 6 weeks,
Okay.
depending on the discipline they're doing. It can be 8 weeks, it can be shorter, depending on, like I say, the disciplines or requirements, or if we're having to do any remedial changes or any changes to help the horse going forward.
Can you explain what you mean by remedial farriery?
Remedial farrier is like specialist ongoing either trims or shoeing. If there's been a problem identified, then we need to try and address it, if we can possibly address it. We also need to take in the factors of the horse's lifestyle, what it's going to be doing, when it's going to be doing it, and if those changes are going to be to the benefit or detriment.
Oh, I
Because if the horse has already put in place a way of coping with something, and we try and change it, i.e. remedial,
Yeah.
we could be causing more problems than we're trying to resolve. So we need to look at the overall picture of what we're trying to achieve and why.
And what are some of the common issues, like on a day-to-day basis, that you see in your line of work?
The common sort of ones are horses that are forged, trip. That could be just down to long toes. You get a lot of hock problems in horses, so you can adapt trimming, shoeing for that. So again, you would be looking at how the horse is going. A lot of people think that farriers aren't looking because they don't ask the horse to be trot up and down. That's not the case. We're watching that horse walk towards us, and if we've got any concerns, we'll ask you to trot and walk the horse up, so we can then have a better look. But equally, we're looking at footwear. We'll look at the shoes.
Mm-hmm.
They tell their own stories, and then we'll have the discussion with the owner. Are you having any problems? What are you expecting of your horse? What are you wanting to achieve realistically?
Yeah, absolutely.
And then obviously the age, breed, type of the horse, whether it's got any issues going on. Has the vet looked at it? Do I need to liaise with the vet? Do I need to make up a shoeing plan with the vet? Do we need any radiographics? Do we need any MRI? It's just a multitude of things to get the best and out of the horse, keep it comfortable, keep it having a good and happy life.
Fantastic, and that leads me on to asking, what should I expect for my farrier when he comes out to look at my horse, and how should I prepare my horse for an appointment?
It's just basic, good hygiene, common sense. Nobody wants to pick up a muddy, wet leg. It's not safe, it's not nice for the horse, it's not nice for your farrier. So wherever possible, you want them in clean, dry feet and legs.
Yeah.
On a hard stand-in that's flat and level, so we can look at them stood up square, because we're not just looking at the feet, we're looking at the overall posture of the horse to see if there's anything obvious there that may be stemming from the feet. And again, if you can provide a safe area and cover, ideal. We know it's not always possible, but we try and maximise the best out of everything that we can. What you don't want to do is turn up to a muddy gateway with a horse up to its knees in mud, because you can't do your best job.
Yeah, you're not
You
gonna be
can't
able
do
to
what's
your
right, and you're
work
more
properly.
likely going to put the horse and yourself at risk trying to work in that type of environment.
Absolutely, you've got to try and get the horse into an environment where you're going to do your job to the best of your ability, really, aren't you?
It's exactly that, and that's what we try to strive every time we go to a horse. Each horse is an individual. It's not a case of robotic going through. We are looking. We might not say a lot sometimes, but that's because we're looking and thinking, what can we do? Is there any changes we can make that's going to maybe slightly change what's going on. Again, that goes back to the shoe wear, the footwear. You're looking and thinking, is that a long-term issue that you're not going to change, or is that something that's developing that you might be able to intervene, do a little bit of remedial, do a little bit of alternative trimming, do a little bit of lots of other bits, and do I need to involve another professional in this?
And in saying that, here at World Horse Welfare Glenda Spooner Farm, they take on the whole horse approach, using a group of allied professionals to work together in the treatment of the horses here. Is that something that's really important?
Very important, absolutely invaluable, because I could be looking and thinking one route, I could ask the vet and they'd be looking at another route, I could ask the physio, they're looking at another route, and then we look at the best route that ticks all the boxes for us all.
Yeah.
It's a discussion, it's not a we will do. It's always a discussion for the best interest of the horse going forward in what we're trying to achieve.
A great team effort then, really.
Massive team effort. Absolutely invaluable.
Absolutely. Well, thank you so much for talking to me today, Ian.
Thank you.
So today, Christine, we're learning all about how to build our horse's annual healthcare plan. Would you mind explaining a little bit about your role and the work here that you do at World Horse Welfare's Glenda Spooner Farm?
Sure. My name's Christine Hopley. I'm a chartered physiotherapist and I am ACPAT trained to work as a veterinary physiotherapist, and I'm also a member of RAMP, which is an organisation that covers a lot of musculoskeletal practitioners. And it's really important that here at World Horse Welfare we assess the horse from all viewpoints. So when a horse first comes in, it's obviously in ISO, it's obviously vet reviewed, the girls review it, and those ponies that can't be handled or are feral, that's their first place to go to really, because they can't be touched by me or assessed by me unless they can be handled properly. But that's where we now have the girls starting their rehab, the ponies rehab, because a lot of the ponies that we see and the horses that we see are very, very weak. Mm-hmm. So now when the girls start doing their handling and picking up their feet, they can also start to activate their core by some simple little exercises of, we call them the wither wobbles, and it allows the horse to activate its abdominals. And then when it comes down that it's been assessed, it's safe to treat, and they want to put it in front of me, physios assess, a sort of specialist in movement. Okay. So we assess how they move. They've already been assessed by the vet, so we know that they're not particularly lame through joint, but maybe unlevel through weakness. And then we assess the horse, putting our hands on the horse to see where the stiffnesses in the body are, through its poles, through its neck, through its shoulders, through its forelimbs, through its saddle area and its quarters. And we will then treat out the dysfunctions that we find, like the stiff joints or the really tight muscles. We'll provide a rehab program which would support what we do with our hands, and also we may use a variety of pieces of kit like muscle stimulators to help to mobilise the horse's backs or whatever. But most importantly, after that first assessment, we set up a treatment plan, which is a for example, if the horse has a very, very stiff neck, I'm not here every week to treat the horse, or 2 or 3 times a week to treat the horse, but what we do have are these excellent rehab assistants, and I can teach them how to mobilise a neck for me, or to stretch out, or to release that muscle for me, so the horse's rehabilitation goes on all the time.
So it's really important then that you have a follow-up. It would be unusual that you could just have one appointment with a physio.
Yes, we always have a follow-up, because the girls are doing the treatment as assessed, and then we've got to take it to the next stage. So sometimes looking at a horse is like looking at levels of dysfunction. So we treat out the most significant, and then when he's stronger in that, or more mobile in that area, then we see what else is left, and what else is left, and what else is left. And so our aim is to progressively and safely move the horse through a series of steps towards him becoming a confident, strong, active pony that may, that hopefully will have another life somewhere in another home. Sometimes it doesn't always work, Sometimes we go along the journey and find that our rehabilitation for that pony, it's got too many challenges in lots of different ways, and then we say, okay, well, his job then won't be as a ridden pony or as a child's pony. It may well just be a companion.
Yeah, so it's being very flexible in your plan and in the end goal.
And sometimes emotionally the horses can't take that pressure or don't want to take that pressure. So the emotional status of the horse is just as important as its physical ability. And the people best able to assess that are the rehab assistants that work so closely with you.
Yeah.
So the whole entire horse is looked at, not just its physical movements.
Yeah, absolutely. So how often should my horse be seeing a physiotherapist? How often should I be booking in appointments? Does it depend? Well, I suppose it depends on workload.
So if you ask me to come and have a look at your horse, one of the first things I'd sort of say is, okay, what do you expect from your horse? Are you someone that just gets on its back on a Sunday and go to the pub on it, you know, or are you someone that's competing regularly? And bearing in mind that horses' shapes change through the years and through the seasons.
Yes.
Some more than others. It's very important that as you would get your saddle checked, hopefully every 3 to 6 months, you would actually get your horses checked every 3 to 6 months as well. The question as to how often depends on who you are and what you do. Professional eventers or dressage riders and show jumpers may want you to come every month.
Okay.
To ensure that the horse is at peak condition, to provide peak performance when they go out and compete.
Yeah.
But if you're a happy hacker and your saddle is fine, your bridle is fine, the horse is not lame, it gets regular farrier and dentistry, then you would maybe think, well, once every, 3 to 4 months may be a good thing, or twice a year if you have no problems. Yeah.
Absolutely.
And sometimes, sometimes we're called out and people say, as a physio check, and maybe you don't need anything more than that first assessment and treatment. Sometimes you need to follow up.
Yeah.
Because it would be unusual for the physio not to leave you with some self exercises that you can do, homework for your horse. Yeah. And it may just be something simple like doing some forelimb stretches or some hind limb stretches, or maybe just checking with some baited stretches, the Garrett stretches that everyone knows so well, that you're doing that correctly and that you can encourage the horse to keep his spine flexible.
Fantastic. And what should I expect from a physio appointment, and how should I prepare my horse for an appointment with a physiotherapist?
Good question, Jordan, because a lot of people don't know that. I think the most important thing is to understand that a physiotherapist would like to see the horse move. Yeah. So if you've got somewhere relatively flat, that you can walk and trot the horse up and down on, that's the key. If you have somewhere that the physios can see the horse on the lunge, that's superb. Okay. If you can assess that. Some people don't lunge their horses, and that's okay. Therefore, we can't necessarily see them on the circle. Yeah. But it helps if the horse is relatively clean. I mean, if it's covered in a layer of mud, then we'll be assessing mud and not the horse's reaction to our palpation skills. And you'll probably, so we'll want to go through movement, assessment on the lunge, if possible. We'll want to check the tack.
Oh, great, okay.
Always check the tack.
So have your tack ready.
Have your tack ready if possible. And, not just the tack that you go out in on a hack, but maybe the tack that you compete in as well, if you're one of those, because sometimes people change.
Yeah, and would you want to see the horse ridden as well? Do you do ridden assessments?
If their problems align to when I ride, then yes. Okay. Or maybe not on that first occasion. Maybe you assess the horse first and then see what happens after that. And it may well be that the rider, if you're really stiff in your back, or if you've got arthritic changes in your own hips, maybe you're the cause of the horse's discomfort or its inability to take a specific canter lead. Okay. So sometimes I might just quickly eyeball how the person's moving and ask discreet questions as to how they look after themselves and how they keep themselves fit for riding. Weakness in a rider or someone that always slumps to one side in the saddle, that can be corrected if it's muscular imbalance. And so it's sort of educating the rider as to, you know, you and your horse are a team.
Because that can have a big impact on the horse's way of going, can't it?
Huge impact. And I always say if you've got really, really tight hips, which a lot of riders do, it's almost like putting a clothes peg on the horse's back.
Yeah.
And, you know, so I think as riders, we all have a responsibility to keep ourselves and our pelvises free and open so that the horse can move better.
Absolutely.
So yes, that would be, I wouldn't attack that on the first
No,
time.
maybe not on day one.
So maybe not on day one. But I think most people that come to see a physio end up having a really good working relationship, and so it's an easier conversation to have down the line.
Absolutely. And you mentioned previously about the whole horse approach.
Yes.
How important is it that you work alongside other allied professionals when assessing these horses?
It's not important, it's essential.
It's essential.
It's absolutely essential to work very closely with your vet, to work closely with the saddler, to know the farrier, and to talk to the farrier about what you're seeing and what the problems you have. We're very lucky here at World Horse Welfare. When I come in, Stuart the vet is here, Ian the farrier is here, and we discuss the horse as a team. And that's the most essential part. Sometimes you don't, and sometimes you find no problems, but if I go out to a horse and I note that it's frankly lame, I'm duty bound to ask to stop the assessment and say, this horse is lame, you really do need to speak to your vet. And I think it improves the complete overall management of the horse.
Well, thank you so much, Christine, for talking me through one of the
my
next steps
pleasure.
in building our annual healthcare plan.
You're very welcome.
Thank you. So today, Julia, we're discussing all aspects of building our horse's annual healthcare plan. In your role as a saddle fitter, how does that fit into this plan that we're building?
Saddle fitting is quite a major part of the whole routine, annual routine for your horse. Obviously, they change seasonally as much as anything, and the amount of work they're into. Also, the horses that come in here, obviously we don't know where they've come from, their previous workloads. Invariably, we start with just profiling them and seeing where muscularly they are, and obviously the physio and vets take it on from there. When they come into ridden work and we have to fit the saddle, that's a whole different ball game. Just taking the sizes and just taking in lots of different muscular issues and things from the past that has happened to them, or just where they've been underfed. Sometimes none, but sometimes you have to take it all into account, and we like to take that. We keep written details every time we come. We profile the horses every time we come that are in work. Work alongside the physio. She looks at our notes, we look at hers, and it's a really nice team to work with and keep it all up to date.
So it's really important to be working alongside other professionals then?
Definitely, and the team here are absolutely unique, to be honest. They are fantastic. Their attention to detail is second to none. They pick up on everything, the footfall, the limb structures. It's just an amazing team to be part of.
Brilliant. So how often should I be getting my horse's saddle checked?
In general, I think if you're, a normal horse owner, dependent on your routine, hopefully it's, stays pretty stable. They advise 6 months, 6 months to a yearly, really.
Okay. Just for factoring into
factoring
our
in seasons
plan.
and everything like that, yeah.
So every 6 months is
the horses here are
average.
slightly different, obviously.
Yeah.
They're coming into a different, so as I say, 8 weekly. Or if they need something in between there, we pop in and run through it if the girls have any worries. But on the outside world, in the normal world, 6 monthly, really good routine to have.
And what about bridle fit? Because I hear, saddle fitting's often spoken about quite a lot, but it's very rare that I hear somebody discussing bridle fit. Is that something that you do in your role?
We do bridle fitters in our role as well. There are specialist bit fitters as well out there, but in this at the moment, it's quite low key. It's not going out there for a competition. The main thing with the bridle fit is that you're not affecting the nerves in the face, and that the buckles are fitting with your eye line, so you're not affecting the trigeminal nerve, and obviously nosebands and stuff like that. But these guys here, again, they like horses to go out uncomplicated as best they can to do the job in hand.
And in your role, what are some of the common issues that you see with horses with ill-fitting saddles?
Ill-fitting saddles, obviously, it's a lot of behavioural issues, causing head shaking, obviously a lot of tension, and then you get the really bad ones with the rearing and bucking, caused through ill-fitting, asymmetry in the saddle panels, or the tree not quite straight, or just badly fitted, too wide or too narrow. There's loads of different things.
And as a horse owner, are there daily checks that I should be doing on my saddle to make sure that it's in good condition? Are there things that I should be looking out for?
Your main things actually to look for are for your safety to start with, or your girth straps. People always bypass the girth straps. They're always looking at their stirrup leathers. Girth straps really must highlight that. And actually that they lay level and straight, you know, because when you're girthing up, that has to be a really nice straight under the tummy, even pressure. So that's quite an important one. And also the width of it, when you're sat on your saddle, that you're not tipping forward. You know, if you're tipping forward, all your weight is condensed in the first third of the tree of the saddle. Again, not a great place to be. Everything's into their shoulders, it's all condensed, rather than taking, the tree is meant there to actually distribute the weight along the whole length of it.
So would I be right in saying that the saddle not only has to fit the horse, but it has to fit the rider as well?
That's definitely it, and that's where your saddler's job really is. You know, it's actually combining the horse and rider.
So I've booked an appointment with my saddle fitter. They're kind of come out and have a look at my horse. What should I expect, and how should I prepare my horse for an appointment?
So really, just preparing your horse, we do like to see him clean. Not so much your tack, we don't like that too greasy, but yeah, your horse, if its back can be clean in its girth line. To prepare it, you know, you've just got to be there and just be honest with the workload that your horse is doing. If you only ride once or twice a week, it really doesn't matter, but just don't say you're doing X amount when you're actually just enjoying what you're doing once or twice a week. Just keep it, and obviously seasonally it changes, but you know, just give them a broad outline and then we can work with that easier, yeah.
And would the saddle fitter like to see the horse ridden?
Definitely.
Okay, so that's definitely something to remember.
Yeah, it's nice. Obviously not always an option, but it does make the difference. Not so much really, we don't worry so much from the horse's point, but actually human weight and how we carry ourselves is quite a different thing, how we distribute our weight, yeah.
I see. And where would I find a qualified saddle fitter?
Online, there's lots of different directories now going. We work through the Society of Master Saddlers, but there are other directories out there, and word of mouth's a really good one as well.
Fantastic. So I'm really starting to build this picture of how important it is that all of our allied professionals work together when we're approaching the horse as a whole. How important is it for you to work alongside the likes of the farrier or the physio, for instance? How does that affect your role?
It just makes life so much easier for all of us if we can all communicate, coordinate. You know, the physio, if they've got to worry somewhere with a hind limb coming through, we can adjust the saddle or we can just put a shim. You know, we can just all work together to actually make it so the horse works muscularly so much better.
All working towards that end goal of having a happy horse.
Oh, definitely, yeah.
Fantastic. Thank you so much.
Pleasure.
So today, Teresa, we're learning all about how to build our horse's annual health plan. And would you mind explaining to me why nutrition is so important and such a big factor in this?
Yeah, of course. I think people that know me quite well have heard this a lot of times, that to me nutrition is so important because it affects either directly or indirectly absolutely everything in an animal's body, ourselves or our horses. So if it's that important, it should be the foundation of every health check. I mean, I am biased, of course, but can I just pick you up on that annual thing? I actually think probably we should be looking at it, well, I used to say seasonally. Of course, there's no seasons anymore.
No.
So I would say that probably you should get it checked every time you decide to change something with your horse, whether it's bringing it in, increasing its workload, or if you see any changes with it. And that's where we come in as a team, because the change may be a health-related one rather than a nutrition one. So you pull in your vet, or it might be lame, so you pull in your farrier. But yeah, so
that is something that I've discussed a lot today, is the whole horse approach that they take here at World Horse Welfare's Glenda Spooner Farm. Is that something that's really important from your view as a nutritionist, that you work alongside these other allied professionals?
Oh, completely. I'm a big fan of farriers because none of us like being told our horses are fat, clearly, and I also say no one knowingly has an overweight horse. But farriers are very good at using that three-letter word for us. So I do find farriers really helpful. And with the vet too, if we're trying to correlate the effect of nutrition on the health of a horse, and the vet's taking the health of the horse, if we only take the nutrition afterwards, then we can't get that evidence base. So we actually say to vets now, it's the 5th vital sign, and they should be taking it every time they do all the other vital signs as a general health check. Just do a quick check on the diet. Is it supporting a healthy horse? Yeah.
Oh, really? That's super interesting. So as I'm building this plan, where would I start in noting down what's important about the nutrition for my horse?
Okay, keep it simple.
Right, okay.
So to me, there's 3 things we need to know about your horse, or you need to know about your horse, and 3 things we need to know about the diet. So from a horse perspective, the first one I want to know is how much does it weigh? And the reason I want to know that is because horses need to eat, as we know, and that will tell me how much food it needs. And I need to know that because they need to eat a certain amount of food to chew, and that keeps them psychologically sane and produces saliva. But equally important, the bugs in their hindgut need to be fed.
Okay.
And so they need a certain amount, so we work on 2.5% body weight.
Right, okay.
The second thing we want is, and some of you might have heard the word body condition score. I don't like that word because it confuses me. I do a body fat index on a horse.
Okay.
The only reason I do that is I want to know if they're eating enough calories, or too many, or not enough. And then the third thing I need to know is their workload. And the reason I want to know workload is I need to know how to compose the diet, depending whether they need more fast calories, slow calories, or occupational calories. So that's the 3 things, and somebody will say, well, what about age? Yeah, of course that's important, but that's not for every horse, whereas those 3 things I need to know for every horse.
And what are the 3 things for the diet then?
So there's 3 things I want to know: what you're feeding, how much are you feeding, and when and how. So in other words, feeding management, because sometimes that's even more important than the actual composition of what we're feeding. And then I match that to the horse, and then we check whether, well, I find out what you're feeding first. Then we look at what your horse is doing, how it is with the rest of the team, and then we see if it's meeting requirements, and if it is, big tick. If it's not, we work with you to try and help resolve whatever the issues were. But what I want is that don't call me in when there's a problem.
Okay.
This is preventative.
Yeah,
Healthy nutrition for life, and you know.
I suppose that's what we're trying to create as well, is a preventative healthcare plan.
Absolutely.
So everything's super organised for the year, you're looking ahead, because I suppose it's quite important to factor in where you're going to get your forage from at certain times of year.
Yep. And again, that seasonal thing. I mean, some years we have good hay or forages, sometimes there isn't any.
And where would I find a qualified equine nutritionist? How would I get in touch with one?
Okay, so there's lots of different ways people can get into equine nutrition, but once they're there, what you're looking for is somebody that's qualified and continues to develop themselves. And you do that by going to the Association for Nutrition, and they hold a register of suitably qualified people, and there's quite a raft of attributes and knowledge and experience that the individual has to meet before they're able to become a fellow or an associate registered nutritionist.
I see, that's absolutely fantastic then. Thank you so much.
No problems.
How lucky am I to get to talk to these fantastic professionals? I really hope that you have found these conversations as informative as I have. To help structure your horse's annual health plan, please visit the website and download the annual health plan template to get started. And whilst you're there, why don't you check out the World Horse Welfare Advice Library? Please let us know what you have learnt from today's conversations in the comment section below. And if you're new here and you haven't already, please like and subscribe. Thank you so much for watching this video, and I hope to see you next time.